Hi, everyone, and welcome back to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jehangir Wellness Center. I am your host, Aakash Jehangir, and today I am back with a very special doctor. We've got someone who has the brightest smile from the hospital, and that's because we've got Dr. Aakash Shah here. He is the head of our dentistry or dentist unit here at the Jehangir Hospital, and he's been with us for many, many years now, and I'd like to welcome him and thank you so much for being here. Doc, let's see the big smile.
Thank you so much, Kavas, for inviting me. Thank you.
Good. Starting with the smile only, we thought it would be
Yes.
the great place to start, given that this is your area of expertise.
Yes.
How do we keep that smile so white? And
You need to have a regular follow-up with the doctors, your dentist. That is the most important thing because in our country, unfortunately, we don't visit the doctor unless and until we have pain. So
you mean pain in your
pain in the teeth or if there is any problem or let's say a bad breath or something. So every 6 months a visit is required so that the dentist can advise you from time to time what exactly needs to be done.
Okay, but what are things that we can do at home before we even come to you?
So the basic thing is you have to brush twice a day. That's the most important advice we give to most of our patients. Use a fluoridated toothpaste whenever possible and eat healthy food.
Like, for example, like what? Chocolates?
Fruits, no chocolates.
No chocolates.
Fruits, vegetables, healthy vegetables, fruits, everything. Avoid sugary foods.
Okay.
That's very important because that will end up into a cavity later on. So avoid sugar items. That's very important for.
But coming back to brushing your teeth, you know, there are lots of things that go around whether people should use toothbrushes that are hard, they should use soft ones. People say should use one, don't use the other. Some people say you should keep switching.
Yes.
So what
ideally, you are advised to use a soft toothbrush.
Okay.
And I personally recommend to change it every 3 months.
change the toothbrush every
Change the
3
toothbrush
months?
every 3 months. And you need to at least brush for 2 minutes is what I advise. Because some people don't brush for 2 minutes. Some people brush too fast, too hard. And that will end up having swelling in the gums or receding gum line and all those other problems.
But then coming back to the larger point, then why is oral hygiene so important other than just looking good?
Oral hygiene is because see, let me tell you, if your eyebrow is missing and teeth is missing, you'll first focus on your teeth and not the eyebrow. So that's why smile is very important. Oral hygiene is very important because if you don't maintain the hygiene, then it's very obvious that you can't have a good smile. And it's really important to have the good oral health.
Other than, and the other thing I've been reading and what people tell me is that it has a lot of effect on your, not just of your mouth hygiene as you're saying, you know, for example, cavities, missing teeth and things like that. But even if you're not taking care of your mouth, it has gastro issues.
To be very honest, not really a gastro issue, but if you have a missing teeth and your chewing is hampered for some reason, if you have multiple missing teeth and you can't chew the food properly, that is where the gastric problems erupt the most.
Right.
So that's why we say whenever you see a missing teeth, please get them replaced. That's very important.
Because I suppose that helps with the chewing and the
chewing and
digestion.
the masticating and all the other functions get hampered because of not having the teeth.
Okay. Well, for example, I thought that, you know, it had some gastro issues. What are the other kind of myths that, you know, that people come to you that you typically have to debunk when they come to you for this kind of thing?
First and foremost is, do not skip the brushing. That is the most important thing. Brushing is very important. You need to limit your sugar foods. That is another important thing. Then third and the most important thing is not to have like the smoking, tobacco, all those habits is a big problem. So that you need to stop because that will lead to oral cancer.
Right.
Okay, so all those things are very important. And of course, the food is the most important thing. Even the alcohol, because that will lead to dry mouth.
Oh, even alcohol is an issue.
That leads to dryness in the mouth, which will eventually reduce the production of the saliva.
Right. Okay.
So that is also something which we should.
And what are things that people do wrong? You know, particularly, for example, I know there are things like people say that you should chew on cinnamon sticks or those kind of things. Or like, what are the common ones that you hear that you typically
all those things in the past, yes, the people were doing that, but that will lead to more of erosion in the enamel.
In the
enamel.
What is that?
That's the top layer of your tooth.
Okay.
That is enamel. What happens is when that erodes, the inner layer is called dentin, which is very, very hypersensitive. And usually the patient comes with a problem of sensitivity with hot, cold, air, water. So that's why we are not advising those things. Brushing too hard, that also leads to enamel erosion. That is another thing which we should really take care of that.
Right.
And that's why a soft brush is always advisable unless a dentist is recommending to go for a hard brush.
Okay.
For
So you're
some
saying
people.
typically people should
Yes.
be using soft brushes?
Yes.
Okay. Interesting. So what about areas like, for example, toothpicks?
Yes.
Should people be using toothpicks? Or I have a very bad habit of using toothpicks after every meal.
Yes.
And people say it's not good for you. You actually don't.
Yeah, I have told you. Ideally, it is not good. Once in a while is okay. But what I would advise is you should floss. That is very important. After every meals, it has been advised to floss. Nowadays, people are using water pick also, which is with the air and the water. You can just floss everything with the water pick, and any food particle which is there in the gums or the teeth which is stuck, it will just come out.
Okay.
So
Okay.
that's advisable. Toothpick, what happens is you accidentally pick something and then you have a
Bleeding.
some bleeding or some if you accidentally hurt your gums, then there is another problem which will
I see.
you need to solve.
Okay. But coming back to smoking, then,
Yeah.
why is smoking so bad for the mouth? I mean, we know that what it does for lung cancer and other effects, but what is it?
It
What is
also
it?
has the oral cancer too.
Okay. Yeah, of course.
The oral cancer is also because the major part is smoking and tobacco. So we,
Smoking and
we
chewing.
deal with a lot of cases nowadays with oral cancer in the hospital.
So how do you deal with that in the mouth?
See, ideally you have to control yourself. You have to stop smoking. Few people can control, few people cannot control. So it depends. It's more of a lifestyle problem, I would say.
Okay.
Yeah, they have to change themselves from within
Okay.
to stop this habit and
Okay.
go on to the alternatives like nicotine patches or
Right. Right.
nicotine gums or something like that. But that is very, very important.
Okay.
Yeah.
Understood. Well, moving on to more area that's becoming more and more popular, and people are starting to do more. People are starting to get more implants and teeth whitening.
Yes.
And things like that. So, what is your take on implants and the use of that? Because the technology for that is becoming
Yeah,
very, very.
nowadays we have,
Why? First of all, why do you need an implant?
See, first of all, when you have a missing teeth,
Okay.
okay, what is we have 2 or 3 different kind of methods for replacement. In earlier days, we used to give dentures.
I was just going to ask
Yeah.
you, what's the difference between a denture and an implant?
Yes, so dentures is basically when you have a missing teeth and you have those plates which can be removed and put it in a box, store it in a water.
You always see them in
Yes.
movies as a comedy movie when old people.
Yes, and nowadays to avoid those things,
Right.
now with the advancement, more and more people are going for implants. That is that helps. That is one of the most popular dental procedure nowadays in dentistry for having a missing tooth.
But what is
replaced.
the material of an
So dental implant is basically made up of a titanium post. It's a titanium screw that is surgically placed into the jawbone.
Right.
Okay, and that acts as a root basically. And when
Sounds
you
quite
can have a
painful. Is it?
no,
painful?
it's a myth. It is painful,
Okay.
but it is not because it is done under local anesthesia.
Okay.
And the process is absolutely painless, you can say, or with the minimal discomfort, I would say.
Okay.
And you can do all your post-operative work within 24, 48 hours. You are absolutely normal.
I see. So coming back to what you mentioned earlier about cleaning your teeth and doing that often, how often do you think one should be doing that?
See, normally I advise every 6 months. That's what the book says. Then every 6 months you should visit your dentist, get a cleanup done.
Right.
If you do not have any habits like smoking or tobacco or anything, and if you are really good in maintaining your oral health, then once a year is also okay.
Okay.
Yeah.
What about things like mouthwash actually? There's another thought that came to me.
Mouthwash, I personally recommend an antibacterial mouthwash.
Okay.
That you can.
But it can never be a substitute for brushing your teeth.
No, it's,
right?
it's never a substitute for brushing your teeth.
But
Because
can
what
you-
happens is mouthwash will just give you more like a breath will change, but
Okay.
with the brush you can actually work on your food particles and layerings and the calculus and plug and charter and
Right,
everything
right,
we need
right,
to
right,
clean.
right.
So mouthwash will never suffice that problem of removing everything.
Okay.
Though it's never 100% with the brush also, and
Right,
that's
right.
why a professional cleaning is
Okay.
always advisable
Yeah,
every
yeah.
6 months.
But another thing that's becoming very popular is people are starting to whiten their teeth or do those kind of things
Yeah.
now more and more.
Yes.
Is that good for you, bad for you? Does it actually have any effect on the
See-
teeth in the sense negatively, positively?
Personally, I feel whitening once in 2 years is okay if someone wants to do it. I personally don't recommend too much of whitening procedures because ultimately we use a lot of chemicals to
I
whiten
see.
your teeth.
Okay.
So unless someone has a specific requirement of whitening, we do, and we advise them to do it twice in a year is okay.
Wait, twice in a year or
Twice in a year.
Oh, twice in a year.
Yeah.
Okay.
To maintain that shade and everything.
A lot of people come to you right before their weddings for,
Yeah, that's a very that's
which
a,
is fine,
that's a
which is a good, which is a good reason for
yes.
people
They
to
all want a good look, so
for people to come to you.
yes.
But I also believe that you, other than being a dentist, I know that you go to a lot of, or you've been a judge for many beauty pageants. Right, Doc? So now what I want to ask you is that I know I put you on the spot now. What I want to ask you is that when you're doing this judging, what is it that you're looking for in these contestants' teeth to judge whether it's healthy or not?
Okay, so what I see is the main thing is the smile. That is the most important thing. This is the place where whitening also matters
Right.
because they are facing the cameras. Every women want to look beautiful. So
And men.
and men too, yes, but especially the women are more concerned than
Yeah,
men.
yeah.
So whitening matters here the most. The smile line, everything we check. Of course, here there is no scope for missing teeth and all. So main important thing is the smile. That's how we judge them on the
Okay.
pageants.
Okay, well then, I think we've been quite educated by what you've been telling us today. But if you had to give us 2 or 3 main takeaways for healthcare or your particularly wellness of your teeth and mouth, what would be the biggest, most takeaways that you would give people based on your experience of people coming to you?
So I would like to tell everyone that do not wait for pain to happen, or do not wait for anything you feel that something is wrong with my mouth and then I'm visiting a dentist. Don't do that. Visit your dentist every 6 months, even if you have a problem or if you do not have a problem. Because anything which we detect early can help us solve the problem.
Yeah.
If we find out a small cavity, we can fill it up rather than doing a root canal or a cap. Or if it decays further, we extract, we put implant. So everything starts from a very small cavity. So if that is detected on time and we
Yeah.
fill the cavity, then I'm sure anyone would not go for any sort of advanced procedures. And we lack this basic nature in our country because lack of insurance, lack of couple of other things. So
Right.
people don't visit. But I would like to strongly suggest that please go and visit your dentist every 6 months and
Okay. That's
maintain your
number
oral
one.
health. Yeah.
So number 2, I suppose, would be brush your teeth every day.
Brushing is, yes, twice a day is recommended. That is there, always there,
Morning, night.
morning and night.
First
Flossing
thing,
is
last
also
thing.
important. Yes.
Okay.
Eat healthy food, nutritious food. Crunchy fruits also help a lot.
So I can eat crunchy chocolate ice cream?
No, not ice creams. Crunchy fruits you can have.
Fine. Okay, fine. And then the third final tip.
Third final tip.
Although I'll be fair to you, you have covered fair amount of within
I think I've covered many.
what we've spoken about.
Yes.
Fine. So thank you for your time, Doc, and your smile. Let's hope
Thank you
that
so
we
much
don't have
for
to
having
come
me
to
here,
you for any
Tapas.
pain at least, but I wish people should be coming to you for their checkups. So thank you very much for being
Thank
with
you
us.
so much. Thank you.
Okay, thanks.